See the slide. Right, so I'll be talking about the language of talk. Now, it's all about excellence in communicator role or mastering the communicator role, right? And I'll just share with you this important actually finding. Right, now trainees may well know that they must be able to trainees may well know that they must be able to develop rapport, build bridges with their patients, be empathetic, paraphrase, use the correct elements of communication, but have difficulty finding and verbalizing the right words or right language. And as a matter of fact, this has been found in all trainees, especially the first few years. You know, they ask them, okay, how would you build rapport? They don't know the language, okay? How to actually be empathetic. They don't know which language to use, okay? So this is what, what brought about the importance of actually writing the exact words or the language of talk, okay? So you really need to know the language of talk actually to know. Now, the language of talk actually for Sudan Healthcare Workforce is a project which has been started, has been worked on actually by Dr. Muhammad Al-Fatih and his team, and I'll be sharing some of what they have actually shared with me, right? The language of talk for Sudan Healthcare Workforce, because the language of talk makes a major impact on the way people interact. The language of talk is about using the right opening words, right body language, and right communication questions, statements, and reassurance phrases, right? Now, these are important because these will enhance data acquisition, as we said in the history, diagnostic reasoning, and allow for more patient-centered management planning, right? And actually, and the other thing that there are other tools for the language of talk, which I'm going to share with you. And these have been shown to improve patient experience and exceptional staff satisfaction. Staff actually who managed to use the right words and the right language of talk actually had exceptional staff satisfaction. Right? Right. Now, it is actually the language of talk is the verbal and non-verbal communication language that characterizes highly professional and patient-centered interactions. It specifically identifies the right words, body language, as well the paraverbal, the tone of voice, the volume of communication between a healthcare provider and a healthcare recipient, right? And that healthcare recipient could be a patient or someone else, it could be a family or someone else, okay? Now, the concept itself is part of being hospitable, right? Now, part of hospitality actually is the language of talk. We become very hospitable. وطبعا احنا عندنا الضيافة في الإسلام is a major يعني إكرام الضيف is a major thing. As a matter of fact, we have a program currently running in our hospital, okay, which is actually we're going to stop using the word patient. We're going to start using the word guest. So we'll tell our guest in room 10, our guest in ward 7, or our guest, okay? And this is hopefully will change the mindset of people to treat patients as guests. And obviously, when a guest comes home to you, you are very hospitable. You provide the best you can for your guest, okay? And its language of talk is considered part of healthcare hospitality, right? And we know that hospitality has two major components, the setting and the practice. The setting is actually how the hospital looks like. And actually, this is what modern hospitals are looking like now. Okay, you can see that modern hospitals look just like a hotel, not like a hospital, right? And so the language of talk actually is part of hospitality or practice hospitality, okay? And they comprise 3 components and the patient love and hate list, which I've just shared with you. And there is something, the language of rapport. And now this has become an international thing. The language of rapport, I will highlight something called the We Care, but which we use in our hospital here. But I will also share with you what international language of rapport is being used. Actually, in so many places all over the world, it just tells you that communication skills are moving, to new avenues. And I'll also share with you the language of clinical communication, the actual words we should use. Okay. Now, this is actually an example from the States, from America, and you can see that they have actually specified what you should say or should not say, right? This is the language of talk. They are actually telling people what you should say and what you should not say. Example, exactly the same as about what patients love and hate. Okay, and this is the list of what patients love and hate, and actually there are a total of 30 love and hate lists, right? And I'll just mention the language of rapport, right? The building the bridges. The most important and first step actually in building relationship with a patient. Okay, I'll use an example actually, which has actually been used by one of our colleagues, Sarah, and actually she presented this case in a meeting for the mycetoma, and a mycetoma case, and people were actually highly impressed because she managed to use the language of talk right at even a very junior level in her training. Right now, she's an elderly with poorly controlled diabetes, type 2, poor socioeconomic status, suffering diabetic septic foot. The patient she talked about, Sarah, was actually a mycetoma foot. The major symptoms are swelling, changing color, bitter and smelly discharge, and fever. Right now, the language of rapport, you see, we have a therapeutic communication technique, the process skills, and some tips. Right now, let's see how to say it. Right, let me see how to say it. Now, this is about rapport. اوكي، مرحبا احمد، الله يديك العافيه، طهور باذن الله تعالى، شرفت، ربنا يوليك بالعافيه، قدرنا نخدمك ونساعدك ونتشرف بخدمتك. You see, this is the language of rapport. Okay, now people have to start practicing this and doing it as a routine, right? You see, the usual thing is about السلام عليكم، وعليكم السلام، ها مالك جيت المستشفى وانتهينا. يعني this is not, doesn't provide rapport. Okay, this is about rapport, right? Now I want to know what's wrong with the patient. See another skill. So this is the way to actually finding out what matters to the patient. يلا يا أم أحمد، احكي لي بالتفصيل كيف أثرت أعراضك على نشاطك اليوم. You see, this is more than just talking about. Tell me about the disease خلصنا. You want to know more about other concerns of the patient. So you say يلا يا أم أحمد احكي لي بالتفصيل كيف أثرت على نشاطك اليوم. As a matter of fact, most doctors actually don't focus on this, what matters to the patient, right? They only focus on what matters to the patient. هل أثرت الأعراض على رعايتك لأسرتك، العمل، النوم، الحالة المادية؟ You see كيف أقدر أساعدك في الأمور دي. These are important things, right? Now, another way of actually communicating, مرحبا أحمد, which is actually about the one who's willing to sit beside or his patient. Right, مرحبا أحمد، تسمح لي أقعد عشان أعرف أكثر عن موضوع الرجل. You see, asking patients that you want to sit, tell them that you are concerned and you are interested to know more. You are not in a hurry. Okay, right? Approachability, right? How to make people feel that we are approachable, right? And this is, for example, this thing is حبابك ألف، ده رقمي خليه معاك لو احتجتي أو أي حاجة اتصلي عليه طوالي. شكرا لإعطائي الفرصة لمساعدتك، حفظك الله. You see, this is the way of having approachability, and this is something that the patients love, right? Now, listening. هاي يا أم أحمد، كيف السكري معك والرجل الحصل عليه شنو؟ كده احكي لي من البداية الحصل شنو، أنا سامعك، كملي. And nodding and making sure that the patient actually notice that people would like to, are happy to listen and take the time. Right, empathy. You see, you can see somebody, she's telling you about her foot, but you can tell that she's very worried, right? But you don't even mention that to her. But it's important to mention it to her when you have noticed that they are worried about things. شايف انزعاجك وقلقك وهو أمر مفهوم، لكن إن شاء الله تتحسن أعراضك ونحتاج التحكم في السكر والتخلص من الالتهاب. Okay, and these are important things. The way we actually recognize what they are going through and confirming to them that we are willing to help them and get them better. You see, we don't actually, make them feel that there is nothing to be concerned about. We have to make them feel that we have recognized their suffering and we are going to help them deal with it. Okay. Now, we have things like the one who notices without being told, the one who always motivates despite patient failure, the one who always gives hope, right? Now, يبدو من كلامك انك منزعجه وقلقه من موضوع الرجل. You see, this is I'm actually noticing without being told sometimes. يبدو انك مجتهده تضبط السكر ان شاء الله تتوفقي. Although she failed to control her diabetes, but still we managed to motivate her. Now I'm sandwiching. You know, we can tell that she's ready. She's worried. ما تقلق بشيء هم الالتهابات علينا زيها كثير والتحسن كان واضح وملموس. الحمد لله فحوصات الكلى ممتازة ولكن على الالتهاب مرتفع لكن تحسن مع المضادات. You see, so we are able actually to make sure you use the right language of talk to communicate. Okay, the one who jokes positively. مثلا صحيح رجلك ملتهبة شديد ولكن ستتحسن كثير تصابي بها أحفادك. You see, these things actually make them feel, you know, their morale uplifted شوية. Okay, is it the one who acknowledges and accepts negative feelings. ما تزعل إنك ما قدرتي تتحكمي في السكر، المهم إنك حاولتي واجتهدتي. The one who digs deeper into her patient concerns. كده أحكي لي أكثر عن بداية الالتهاب عشان أعرف تسلسل الأحداث والعلاجات اللي جربتيها. The one who identifies and focuses on her patient's most important concerns. You see, قلت إنه ما قادرة تنومي، يكون القلق حاميك النوم ولا من شنو عدم النوم. قلت إنه لسه في إفرازات، يعني الرجل ما تحسنت نهائي ولا الالتهاب زاد من الأول. You see, the ability actually to articulate all these things, you know, helps patients actually feel better. كويس. Now restating or paraphrasing or reflection. قلت إنه الليل كله ما قادرة تنومي، يعني عندك أرق بسبب القلق. يعني هي قالت ما نامت، معناها صحيح كانت قلت الليل كله ما قادرة تنومي يعني عندك أرق. قلت الإفرازات زادت تقصد إنه ما الرجل ما تحسن التهابات زادت. Reflection means that you tell patients that they are worried about something but they don't want to tell you. You can, you know, you can see it from their face. يعني مثلا you can tell, which دكتورة سارة wrote nicely. She said يبدو إنه أنت قلقة من البتر ولكن ما عايزة تقولي لي. This is what his reflection is about, and this is another higher level of you know, interaction or communication, right? And then chunking. Chunking means that you're able to put, you know, chunks or small parts of your history in points, right? مثلا you can say there are مجموعة من الأمور. خلينا أكرر اللي قلتيه، عيد اللي قلتيه عشان أتأكد منك إني فهمت اللي قلتيه بشكل صحيح. This is all part of you know, making sure that we are actually good listeners. And you chunk things. ها قلت لي موضوع النوم، ها قلت لي موضوع الألم، ها قلت لي. This is chunking, right? And open and ended questions, and then summarizing. You know, the ability to summarize at the end. ها من الكلام اللي قلتيه من الكلام اللي قلتيه أفهم إنه السكر له 25 سنة وكان هناك صعوبة في التحكم بسبب عدم قدرتك على توفير العلاج، وإنه التهاب الرجل بدأ جرس صغير وزاد مع الوقت. It just confirms to the patient you have been listening. Okay. ومع التأكد إنه ما نستعمل الجارجون بتاع الميديسين، الجارجون ميديكال تيرمز. Okay. ونفس الشيء ممكن الواحد يستعمله في السبايكس بروتوكول و we can use it. يعني the great thing that actually Dr. Muhammad Al-Fatih and his team prepared is they managed actually to actually put the dialects of the local culture. مثلا الدايلكت بتاع الشوايقة، مثلا حبابهم أحمد الله يديك الصحة نورتي ربنا يتم عافيتك. دحين بدورك تحدثيني برواقة كده عن السكر والكراع كملي سامعك. يعني you can actually use the language of the dialect or of the local culture. Okay. يعني and you can actually make it for the, you know, for the sake of the local people, right? Even in West Sudan, again, يعني West Sudan عندهم their own dialect, and you can do the same thing. You can actually put exactly the same things, right, by the local dialect, and this was really a great step forward by Dr. Muhammad Al-Fatih and his team actually, and they managed actually to write the exact words, right, for the local culture. And believe me, if I go to West Sudan, I would really like to be talking the same language of the local people, right? Because that builds rapport with them, right? And even this is one by the Nubian language. this would be obviously difficult for me, but ولكن it's actually doable, and actually the team, Hamad Al-Fatih team, actually managed to do the same thing with the local language, right? So it's an excellent way of actually writing the language of talk using the local dialect, as per the local culture, right? People have actually in the communication skills have moved a step forward. Actually, they actually developed something called acronyms and mnemonics in communication, and this is the one we use actually at our hospital here. Now, this is actually just for building rapport. The acronyms are for building rapport, okay, or mnemonics. And this is the one used here at our hospital, right? And they have something called We Care. And We Care actually stands for We for welcome, W, E for embrace, أو الضم والاحتواء, compassionate, التعاطف والاهتمام, apologize, respond, and express gratitude الامتنان. Now they have used it, and they said we معناها these are the words you use for the welcome. These are the words that you use for embrace. These are the words that you use for compassion. These are the words for apology, for responding, and for express. So you say مرحبا بك، أنا مثلا دكتور عماد، تفضل، السلام عليكم، كيف حالك، أهلا وسهلا، كيف أقدر أساعدك، يا هلا وغلا، أمرني وش الخدمة اللي أقدر أقدمها لك، أمرني الغالي في الخدمة تحت أمرك. You see, and they have gone through all the things, right? And these are, obviously this belongs to the hospital where I work, so people cannot just use it. They have to take permission. But it just tells that people have moved, many strides forward to improve the way we communicate. Now, this is not only at our hospital here, We Care, right? But the aided tool is another one actually from the States. Now, it's used by one of the biggest healthcare provider called Kaiser Permanente in the States. Now, the aided tool stands for acknowledge, introduce yourself, duration, explanation, and thanks, right? And it just tells what people should do. This is actually for the Kaiser Permanente. But then the Cleveland Clinic, another big healthcare provider in the States, right? They have something called HEART, which stands for hear, emphasize, apologize, respond, and thank. And they say that this simple acronym helps people actually communicate perfectly well and build rapport with the patients, right? And so this is brought something new, which is called the elements of communication, that when we see a patient, we use either We Care or HEARTS or aided, right, to build up our elements of communication. So we have to, like hear, that's being good listeners, right? Emphasize means that we be empathetic. Apologize if we're late, for example, and respond to all their questions and thank. Or in the aided, like acknowledge. It's about actually smiling and face-to-face eye contact, okay? So these are actually important acronyms used in current in improving communication between staff and patients, right? So it's all about a new era which we're going. And as I said, we always want to make our patients feel better, through our communication, right? So communication competency is the number one and cheapest tool for improving the quality of care. And I showed you that, how many 10 quality issues actually are impacted by communication, right? Negatively impacted by communication. So improve communication, improve 10 quality issues in healthcare, right? And unfortunately, you have to have deliberate and regular staff training and certification. You cannot train people. People are not born with good communication skills. They actually have to learn the communication skills. And this is what the language of talk is about. So I'll stop here and thank everybody for listening. And the floor is open for any